This year in Georgia, 5,000 women will be diagnosed with breast cancer.
Breast cancer not only affects thousands of patients each year, the disease has a staggering impact on spouses, children, and other family members. And that's why the Nancy N. and J.C. Lewis Cancer and Research Pavilion at St. Joseph's Candler combines space-age technology and compassionate care to create one of the most innovative oncology programs in the country.
We have many aspects of managing breast cancer in place. And from the multidisciplinary conferences that meet weekly that are tied with recent releases of information from the National Cancer Institute. And when we're looking at our NCCCP programs, that's one of the outcomes that they want to assure. Are our patients, if you come to our center, are the patients getting this multidisciplinary review of their case? Are they being seen by the surgeon, the medical oncologist, the radiation oncologist? Is the best treatment plan being developed for those patients?
In conjunction with the Telfair Pavilion, the region's leader in outpatient women's services, the Lewis Cancer and Research Pavilion's comprehensive multidisciplinary team of oncology experts offer a full continuum of care in areas of outreach, prevention, education, diagnosis, treatment, pastoral, rehabilitative, and palliative care.
What we're doing for outreach here at St. Joseph's Candler and the Lewis Cancer and Research Pavilion is getting out there, informing the community about early detection, prevention, the importance of doing monthly self-breast exams, getting to know what your breasts look and feel like. We developed a program for community health advisors to get out into the community and help with the education, to be the bridge to access to care for people in our area, not just for breast cancer, but for all cancers as well, and to provide education in the community. We work along with other organizations that's a part of the NCCCP program to help develop best practices, to make sure that we're doing the standard of care and that we're finding new and innovative ways in which to provide that care.
St. Joseph's Candler is very fortunate to have digital mammography across the board at all three of our facilities, which is Telfair at Candler, St. Joseph's Hospital, and our mobile mammography unit, which goes all out into the community and serves many, many more counties besides our own. So we're very lucky to have that. The benefits of digital, of course, are technologically it's better, been proven better for women with denser breasts, which would be younger women or women who have been on hormones, and it's harder to see breast cancers in those patients. So it's a great technological advance. Obviously, it's more comfortable for the patient now with the advent of flexible compression pedals. Anytime we can make it more comfortable, that's great. It kind of allays that fear of just having the mammogram to begin with.
The Telfair Pavilion is one of a select few in the state to be accredited as a breast imaging center of excellence.
Digital allows more fine detail to be observed, and the better the detail, the earlier the detection of disease processes in the breast. And the whole idea about breast mammography is to detect cancer early, and that way you have the better outcome. All of the digital images are stored in a PACS system, which is a system that correlates the old images as well as the reports and makes it much more readily available for interpretation and provides a better care for the patient.
As one of the select few in the country to be accredited by the American College of Surgeons, the Lewis Cancer and Research Pavilion offers progressive, individualized care in an environment that inspires courage and promotes healing.
We do function as a team. We all are professionally committed and we're committed to our patients. We like to be challenged with the new things that come about in cancer treatments. We like to challenge each other. Most of the nurses are nationally certified in oncology. We do have a camaraderie with our patients, with our families. We like to offer them something, and as we've said before, we like to make an unpleasant experience pleasant.
The reason why St. Joseph's Candler is so special, that every Wednesday we meet at 7 in the morning and discuss every patient with breast cancer, review all their x-ray to review all the pathology, and then the presence of the surgeon, the radiation oncologist, the medical oncologist, usually more than one member of these specialties. And we sit there and we formulate a plan for each patient with breast cancer. So I think this is extremely important that everyone is on the same page with management of each individual patient.
The Lewis Cancer and Research Pavilion is also one of only 10 health systems nationwide to be selected as a participant in the National Cancer Institute's National Community Cancer Centers program, an advantage that puts Savannah's breast cancer patients at the forefront of medical breakthroughs.
We have excellent mammography with radiologists and ultrasonographer that just are state of the art. Not only are they excellent in their chosen area of mammography and ultrasound and all the technology, but they're really good people, and women, they really treat the women well. Our technicians treat the women well. So it's a good experience. And also, it's a rapid experience. So if they find something abnormal, and if the patient agrees, the patient can have a biopsy that day, and then come over here and have a multidiscipline conference with that same day with a medical oncologist, a radiation oncologist, and a surgical oncologist, with her and her family. So by the time she leaves here with that terrifying experience that she has a lump, they say it's something that needs to be looked at further, she can have a biopsy and then have a conference that day and leave with staging and a treatment plan. That's the way it should be done.
Comprehensive, innovative, and patient-focused, the integrated efforts of the Telfair Pavilion, the Lewis Cancer and Research Pavilion at St. Joseph's Candler, and the National Cancer Institute's National Community Cancer Center program is helping breast cancer and all oncology patients and their families live smarter and healthier lives.